cut herself, and I wasn't sure whether or not I should take her to the urgent care center or the emergency department. How can I know when it's important to go to the ED as opposed to an urgent care center?
When is it appropriate to go to the urgent care for a cut versus emergency department? It depends on the location and the size of the cut. If a cut is longer than about 3 inches or extremely deep, where you might be concerned about cutting tendons or tissue underneath, it'd be important to go to the emergency department. There they would be able to give some more intensive repair, and also, especially with a tendon injury, have the follow-up with either like a hand surgeon for something as critical as that. But something that's about 3 inches or less, not incredibly deep, I think we can really handle that here at urgent care and prevent having to go to the emergency department.
In the event that she does need stitches, what would have been the best way to care for them at home?
Basically, the best way to take care of a suture wound is to keep it clean and dry. I tell my patients that. When an area is kind of wet or moist, it doesn't heal as well. And we want to have the best kind of healing to prevent scars or any sign of infection. If a bandage is put on it and they bleed through, or it gets wet or dirty, you want to change it. It's only going to keep the wound from healing correctly. The other thing you want to watch for is any signs of redness or swelling around the wound, or any kind of a discharge. That would indicate a sign of infection, and it needs to be reinvestigated by the physician. In general, once the wound has been there and healing about 7 to 10 days, you can start to wash and keep it clean. I wouldn't want anybody to prevent having good hygiene just because of that. The other thing you can do is you can put small amounts of antibiotic ointment on it. That'll also help it heal. And sunlight itself will also inhibit the healing process. Nothing stops skin healing like ultraviolet light.
If it doesn't require stitches, is there a good way to care for it at home?
Number one, wash it, soap and water. I can't emphasize that enough.
Yeah.
I tell everyone wants to reach for the peroxide. That's not the agent you really want. Soap and water. It will clean out any kind of germs and any kind of sediment that might be in there that might cause infection. Basically, if it's superficial, meaning it's not very deep, clean it. You can put antibiotic ointment on it, a Band-Aid. If it's more of like an abrasion or a scrape or even a skin tear, the kind of bandage you want to use is a non-adhesive, like the Telfa brand. Mm-hmm. It'll keep it from sticking. Otherwise, a cotton gauze is fine, or even a self-adhesive bandage, depending on the size of it. An antibiotic ointment would be also something you could apply. Again, watching for signs of infection, redness, swelling, red streaking, or a discharge.
When treating a wound at home, what happens if the bleeding doesn't stop? Is there a certain time frame where you should be concerned?
Well, the first thing we teach Girl Scouts, Boy Scouts, from all the way up, is when you have bleeding, you want to hold pressure. It's the #1 way to stop it. Most people don't put enough pressure on it. I can't emphasize again that enough. Put a piece of cloth on it, or a clean rag, or better, a Band-Aid, and hold pressure. If you can control the bleeding at that point, if it's bleeding through the bandage, don't take that off. Put another bandage on top and hold on. But if after 20, 30 minutes, if you're still having bleeding and you can't control it, you'll find this sometimes with people with blood thinners, or they're taking aspirin daily. It's hard to control. Then it's important that you go either to the urgent care or the emergency department, and we can help control the bleeding for you.
You had mentioned applying pressure to a wound to help the bleeding stop. Is there anything else?
Well, one of the other things you can do is also elevate it. You want to elevate it above the heart level. The other thing that's important to note is the type of bleeding. Most bleeding is just very flowing, but if you get pulsatile bleeding, then that would indicate you hit an artery. That's a more serious cut. If it's really intensive bleeding and it's very pulsatile, I would probably call 911 and go right to the emergency department. If something that you can control briefly, I would probably still go to the emergency department as opposed to urgent care because of the type of injury that you sustained. It may need some more intensive care than we can offer here.
Okay. You had also mentioned animal bites. Is there any certain precautions that should be taken when getting, cut with a wounded object or bit by an animal?
Puncture wounds in general, we worry about. With animal bites, they're considered more of a puncture wound. And with that, you have to keep in mind that animals, dogs and cats, which are the most frequent bites, all have bacteria in their mouth. The worst bite, of course, actually is human bites. Believe it or not, we have more bacteria in our mouth. But any kind of puncture wound, it introduces the infection into the skin. And with something like that, it needs to be thoroughly cleaned, followed up, and you need antibiotics without a question. Some human bites or really deep cat bites actually should go to the emergency department, particularly with the hand. You worry about infections to the tendons or the areas, and we probably need referral with a hand surgeon. We talk about other types of bites, bats, or rabid dogs, or thinking we worry about rabies. That's important too. You want to follow up and make sure, we do that here too, but just to follow up to see if the dog or the cat are vaccinated against rabies. Obviously, wild animals you're not going to know unless they're able to capture them and observe them. That being said, you'll need to have a rabies vaccination. We don't have that here at the urgent care, and that would be something I would recommend, to go to the emergency department to get the rabies vaccine. The other thing we worry about is tetanus. Tetanus is a bacteria that's found in the dirt. Most people don't think about it unless they step on a rusty nail or run into something rusty, but it's out there all the time. If for some reason you cut yourself with something like a fence or anything that's rusty or questionable, we'll always ask you about your tetanus status. You want to have your tetanus shot every 5 years or so to keep yourself up to date. They also have a new one out right now that actually contains the pertussis vaccination that we're giving to adults to help protect them against whooping cough. You only need one of those. But that's also important to check your status and make sure you're immunized.
Now, does eMedical Urgent Care actually do the tetanus shot as well as the pertussis?
Yes, we have both we can offer.
Perfect. My friend actually did cut herself on a fishing hook. Should we have taken extra precautions to make sure that it wasn't infected, or does it not matter?
Oh no, it matters very much so. It depends on what you get cut with. Very rarely does someone pull a sterile fishing hook out, or they pull something sterile out of the garage. It's usually infected with other kinds of bacteria that live there, tetanus or other types of bacteria. It's important that it gets covered with an antibiotic. Again, can't emphasize the soap and water and washing it out. But it's important with any kind of a puncture wound, like a fish hook or a bite or a nail, stepping on a nail. It's important that we see it, irrigate it, and put you on some antibiotics to prevent infection.
Thank you so much, Dr. Sennett, for sitting and talking with me today. You've been of great help, and I look forward to the next time one of my friends get cut.
We're here for her. God forbid.
Yeah.